Hi, I'm Dr. Thomas Su at ArtLipo Plastic Surgery, where we specialize in treating patients with lipedema, and that also includes patients who just have ankle fat, calf fat that isn't lipedema, but it's the same type of surgery. So what I want to talk about is our virtual consultation. And our virtual consultation is very different from what other doctors talk about when they say virtual consultation. They may talk about getting on the phone with you or getting on a Skype call with you where they can see you face to face. However, where other doctors talk about what they're going to do, we actually will show you what we can do, because we're going to have you send us your photographs, and either myself or one of the other doctors will actually draw on your photographs. When we draw on your photographs, it's going to be from different angles, and I can show you exactly what your new body is going to look like. And I don't mean exactly 100%, but I'm talking about very, very close to what we're going to accomplish. So it's a very unique process. It's taken me 15 years to evolve this process, which again, I don't think anybody else out there does. And you're going to get to take a look with me kind of behind the scenes and see how I do the drawing, because we're going to set things up here where you can actually see me doing the drawings. And when we talk about lipedema, some people, lipedema is something that affects women in their legs most of the time. About 30% of cases, the arms are also involved, but we're going to be looking at the legs today. If you want to see how we do virtual consultations for the arms, go to our celebrity arms section and you'll get a good sense of that. Back to how we treat lipedema legs. Some women are affected mainly around their ankles, calves, and knees. Others, it goes right up into their thighs. So I'm going to do a variety of drawings on different patients that I'm going to show you in a second, and the different things that we can do, and we can tailor your treatment to whatever part of your legs bothers you. Okay, so join us, and we'll be doing that in a second. We're back again, and what we're going to do here is I'm going to talk a little bit about this patient here who has lipedema. It's either late stage 1 or stage 2 patient. She actually has a lot of fat, you can see, around her ankles. She has a classic cuffing with sparing of her foot. You can see her feet don't have any fat. Her fat's very concentrated all the way up through the knees. And then as we get up to the thighs, her upper thighs are not unusually large or anything. So the bulk of her fat is between her ankle right here and her mid-thigh. So this is one of those cases which is very common in my practice, where I treat from the ankle to the mid-thigh, and I split it up into 2 zones. I call the area from the calf down to the ankle the cankles, okay? That's calf and ankle. And then from the calf, upper calf, up into the mid-thigh, which is centered around the knee, we call that the knee complex. Other doctors do this little area right in here, which is a little bump on the knee, but what we do is from here all the way up to where my pen is, and we do it in a circumferential manner, 360 so to speak, to slim the knee from all directions. So what we're going to be doing is a lipo 360 of the ankles all the way to mid-thigh. And so I'm going to go ahead and show you how we do this. I usually start off by drawing the outline. People always ask me, Dr. Su, how do you know what the shape is going to be? And it's because I've studied the human figure through figure drawing in my college years. I'm an art major, fine arts major. Drawing and sculpting was my background. So I have a bit of experience before I ever got into med school. And not that they teach any doctors in plastic surgery residencies anything about art or the human figure either. So I came in with a very developed background in this before we ever started. But I can look at a leg like this, and I can tell where the unique features are of the knee bone. I know that the calf cuts in certain angles. I'm just going to start drawing here. And in my mind, I'm visualizing where that outer contour of the knee is. And as we get down here below the knee, there is a little concave shape right here that separates the knee bone from the calf. And then the calf muscle right here has a little rounded edge. And then we get into this concave shape right here, which is below the calf muscle and above the ankle. This is, I'm about to show you the outer contour, and this is where I hardly see any doctors concentrate, and that's on the lateral aspect of the knee. But what's very important is that we actually have a sloping in of the thigh from this midsection down into the knee. The knee should be the most narrow aspect of the entire leg. What I compare that to is on the upper body, it would be important to have the thinnest aspect be the waist, because that makes a woman, or a man for that matter, have the shapeliest figure on the upper part. To have a thin waist makes the upper torso look great, and it makes the hips look great. Well, on the legs, you want this middle section right here to be the thinnest aspect. So, okay, if you follow me down here, we're getting over the gastrocnemius, the calf muscle, and we're coming down into the lower leg, which is just like that. So I know you guys can see this nicely, but what makes it even more visible and easier to see is when I put a black background behind the leg. It gives some contrast that really allows you to see the new shape better. This is what has taken me years to develop. I mean, initially I would draw things out for patients in different ways, but this is something that I think does it the best to allow you to see things with the most clarity. This is not taught by anyone. This was developed by me and the other doctors at ArtLipo. So we love to do this because it really shows you the new shape. Now what I'm going to do here, I'm showing you one right next to the other. I'm going to go ahead and finish out this drawing, and I'm going to do the other side too. Rounding up around the knee, cutting in above the calf, coming over the calf, dipping in below the calf, and then a little bit of a bulge out right where the ankle bone is. And then doing the same thing on the outside, coming in, the knee is the thinnest aspect right there. We're coming over the outer part of the calf muscle, and then we're following the tibia as we come down here. And there's a little bulgy aspect of fat right there. I'm going to just knock that out. And we try to take away anything that's distracting. So I'm getting rid of all this empty space and trying to make it look like a frame, a picture frame. And that's what allows a person to be able to see the legs just for what they are and without any distractions. So there we go. We have the transformed legs, and that's how it happens when we sculpt also. What you take away leaves a shape behind. And I'm just going to line up these before and after images here for you to see. And you can see her previous legs, and now you can see what her legs would be done afterwards. Okay? And that's what we'll do for you when you send us your photos to draw on. I'm going to show you her, this same patient. She's a good example of someone with, developed lipedema. Here's the backside, and you can see how thick her calves are right here. Her calves, as well as the ankle area compared to her upper leg. It's even more pronounced when you look at it from the backside. So here we have some cutting in. We have the top edge of the outer calf muscle right here. We have the calf muscle itself, and then we have the leg as it slopes in. We're coming around the outer knee, dipping in right there where it dips in a little bit below just above the calf muscle. And then we have the calf muscle itself. A lot of thickness right there. So we will draw this in. And I'll tell you what, drawing is one thing, and I know that the shape exists underneath the fat. When it comes to removing the fat, it is a process that takes a lot of skill, and also at times it takes a bit of luck because everybody has fat that's different. And for some people who have very fibrous fat, it can be more difficult to remove that fat as completely. So that's why there is a little bit of variation in what we can achieve compared to the photo. But knowing anatomy, I know that this shape exists underneath the fat layer. And if you look at our before and afters, you'll see that they're very significant. The difference between us and with other doctors is that not all doctors are the same. I usually will get about 80 to 90% of the fat removed. That's that fat layer above the muscle. There are a lot of doctors who are taught to be conservative. I would say most doctors are taught to be conservative, and what that means is that regardless of the body area, that most doctors only take about half the fat, 50%, and they think that that's a pretty good result. I never did, so that's one of the reasons why my results are so noticeably different, is because I get the majority of the fat, 80 to 90%. Nobody gets 100%. That last 10 to 20% has to remain. Otherwise you would get scarring between the skin and the muscle. Anyways, what I'm showing you here is about 80 to 90% removal. So that's a typical lipedema patient. I'm going to go back to our original drawing right here, and I'm going to show you that in this lipedema patient, this patient may complain about more than just her ankles to her knee area. In this case, I think we've established a very nice appearance of her legs. However, this particular patient, although we didn't do anything, let's say she had lipedema symptoms going all the way up in her inner thighs and outer thighs. So what I'm going to do is I'm going to complete what things would look like if we did the entire leg top to bottom. And this is what we would do in many lipedema patients. They have symptoms of their entire legs. So we end up doing a 360-degree lipo all the way around. But follow me out here. We took out her inner thighs and outer thighs. This is what things would look like. Now, I can't show you what the frontal thigh is going to look like because we don't have the right angle, but in a 360 we'd be doing this frontal part of the thighs also. And you may have noticed that when I do the entire thigh, I can actually make these lower areas even thinner, because what happens is when I'm just doing halfway there, I have to blend out so it matches the upper leg. But when I can do it top to bottom, I can actually take it down even more than if we were just doing half the leg. So let me get the original. So here we go. This is the patient's shape before and after a full leg lipo, top to bottom, 360 degrees. Okay. All right. So I'm doing a variety of different things for this patient because I'd like you to see the difference between what we can accomplish. I mean, when you send me your photos, you don't have to tell me what it is that you want exactly. I mean, you could tell me, hey, Dr. Sue, I have lipedema and I'd like you to show me what you would recommend. Or you could say, you know, my knees really bother me, or my ankles really bother me, my calves bother me the most. I'll take direction from you to try to accomplish your goals, but I think that most patients would like to see what I can visualize because I have so much experience, you know, looking at things. So when I do a drawing for you, if I was just doing from the ankle to the mid-thigh, you may come back and say, well, Dr. Sue, you know, I think I may like the upper thighs too, and then I can just do a new drawing for you. So anyways, there is you know, a lot of different things that we can do for each person. This is just another patient right here. She has lipedema also. As you can see, her fat is really, it looks out of place, you know, from her mid-thighs, around her knees. That's the knee complex area that, you know, that I've explained to you right here between my fingers. Down around her ankles, it's not quite as thick, but we're going to see what I expect to create right here. I think she has some nice calf muscles and calf shape right here. And what I do when I draw this out, I've trained myself to visualize what's underneath the fat. Every time I do a drawing, I have to visualize it before I actually draw it. And this is very different from what other doctors do, because when patients walk into a typical cosmetic doctor's practice and they say, I don't like my thighs or I don't like my knees, you know, I like that liposuction. The doctor doesn't do a drawing. They look at it and they go, okay, yeah, we can do it. It's going to be a little bit smaller. We're going to take out this many pounds of fat, or we're going to make it a couple of inches smaller. Those are all estimates, of course. We all have to give estimates. However, they don't get in the practice of visualizing things. And when you don't visualize something, what you take is just something that is a function of what you do when you get in there. And if you don't visualize this in your mind to begin with, you will not end up with this result. It takes a lot of, you know, it's like if you say, I'm going to run a 4-minute mile, you're going to work yourself to do it. If you think, I'm just going to run a mile, it may take you 5 or 6 minutes. So thinking about what you're going to create before you do it is very important. And I think that's where a lot of cosmetic surgeons miss out, is in this kind of practice of doing this. Okay, so here we go. We have one leg looking a lot more slender, and the big part of that slenderness is happening around the knee itself. I'm going to show you on this patient, if I only did the knee complex, which is from here to here, what it would look like. And I explain that to a lot of patients because not everyone has the funds to do everything that they want to do. And I can show patients how they can achieve a much nicer look even without doing the whole thing. And so we're just going to do the knee complex. That's again here to here. Bone structure. And we're coming in right here, really making that knee the most slender area. And in this case, we're leaving the calf and ankle area untreated. So we're not doing the full cankles. Doing a little bit of the upper calf. But this should show you why the knee complex is so important. You can get a very slenderized look to the leg just by treating the midsection. There we go. So if you compare the legs before being done to just the knee complex right here to the full leg right here, or from, you know, the full ankle to mid-thigh area. And I think what we'll do now is I'll just go ahead and show you what, you know, it'll look like with this inner thigh area being done too, and with this outer thigh being done. It's great playing around with this. I mean, it doesn't take me very long to create this drawing in a number of different ways. And the drawing is, you know, very representative of what we can accomplish. So you can see, okay, now if we did the upper thigh, what it would look like. And how about we just go ahead and bring in the other. So we have a full representation of what the legs can be if we did a top to bottom here, and just leaving out the calf right there. Okay, so that's how it's done. So as I talk a little bit about lipedema here, we'll just start showing you some before and afters. And I hope you've already had a chance to see some of our before and after photos, which are on our website and our before and after gallery. But in case you didn't know, we do a lot of live patient videos, okay? And you can find those either on our Lipedema page and or on our Instagram and YouTube pages. We have a YouTube Lipedema channel. So anyways, you'll see all our videos there, but if you haven't seen that, we're going to show you some examples right here of how it can transform the legs, and also show you that it's done completely awake. Our patients are actually helping me in what we call boot camp lipo, where they're actually tightening their muscles and holding in different positions.
Incredible.
And it's very interactive. So you'll get to see the patient standing up because they're wide awake, and you'll get to see here in this segment right here where we're showing some of the videos how the patient gets to see her immediate results.
That's crazy.
And it's pretty overwhelming. I usually tell patients not to take a peek until we finish the entire side, and when we stand them up, they actually get to see something that blows them away. Okay, so enjoy seeing these before and afters, and thank you for watching.
Oh my God, that's insane.